and then hand it off to Marty. Like many things within healthcare, regardless of the situation or the circumstance, our priority always has been, always will be, providing high quality care to patients, thinking and prioritizing the utmost patients' well-being and their safety. Our ability to adapt to the situation with COVID was very challenging, not only from a medical standpoint, but from the fact that it had a much broader societal impact, and without getting into all the details of that, it affected much more than healthcare delivery. There's a lot of fear and anxiety related to COVID, appropriately so. And I think our ability to continue to serve patients with an IHA was really related to our leadership team recognizing very early what we were up against with the ever evolving and fluid situation with COVID. As soon as we took inventory of what was happening in other parts of the world, and then also on the east side of the United States and in Washington State, we put together a group of very highly skilled clinicians who had expertise in operations and also in infectious disease and other specialties to really create a unified response, which really involved early on segregating patients who may have been at risk for COVID from patients who had other chronic medical conditions, really being very nimble and standing up video visits. Currently, in some of our practices, as many as 50% of the visits we're still seeing, what we're seeing patients with is utilizing the video platform. Recognizing that if patients are not getting routine health care, not only are they at risk for COVID, but then they're also at risk for those underlying health conditions worsening. So we knew we had to be able to quickly adapt and provide other ways for patients to access us. And we've been able to do that relatively quickly. And then finally, I think sometimes understated, but incredibly important, we stayed in touch with our patients. We sent several communications via email, via our website, via our phone trees and other platforms to reassure patients that we were still open for business. We still were there to meet all of their needs, and really emphasize that they can continue to access our care in a safe way, prioritizing their safety and their well-being. And as we start coming out of this situation slowly, we're continuing to emphasize those items. So that's, I think that's how we partnered with our patients to be able to continue to function.
Andy, I would say, on my side, so Mo's been doing a lot of the operational work, and I've been kind of helping to lead some of the clinical work. One of the biggest challenges was to quickly stand up testing in our community, and we were able to do that. We had started the first testing site in Washtenaw County, which we did as a drive-through testing site, and now we've also we had quickly stood up fever and upper respiratory infection urgent cares in our communities as well, so that we could segregate patients who might be symptomatic with COVID symptoms versus segregating patients that had other illnesses, so that we could limit exposure. And so we've still been doing a large amount of testing and feel like we have adequate amounts of testing in our community. We get asked that question a lot. I think the second thing that was really important was clinical updates. This is truly a new disease, and there's not a lot of information, and the first information coming out was out of China, and that was limited information. And so keeping all of our clinicians up to date about what is the most most beneficial way to treat patients with COVID in both an outpatient and an inpatient setting, and giving them the most up-to-date information on what are the testing criteria, what is the testing available, and things like that has been really beneficial to be able to do that, and we had to do that quickly as well. And then I think that not the last thing, but probably the most important thing to us was keeping our patients safe. during all of this. And so, we started screening all of our patients at all of our practice site locations that are open. Now we're screening with a temperature and then also screening for symptoms at our practice sites. And if patients have any symptoms that are potentially considered to be COVID symptoms, which that symptom list is expanding every day, unfortunately, then they're seen at a practice site that we can do it more safely. And so we're just doing everything we can to try to keep our patients as safe as possible. We're masking all patients, we're masking all staff. So we ask all patients to wear a mask in, and if they don't have one, then we'll give them one when they come. We ask them to wash their hands when they come in, and then we're cleaning our facilities regularly based on the CDC guidelines for cleaning. So really just trying to see our patients in a way that is as safe as possible. When I think about a crisis, I think about what have been the biggest benefits. I try to think about this positively, that we've gotten out of any type of crisis. And I think standing up telehealth has been a huge benefit. And I think our patients have really liked being able to see their providers, and gives them some reassurance based on telehealth. And many of you might not know, but one of the challenges to getting telehealth stood up was that the health plans weren't covering it, and now they have been in COVID. So we think that that's going to be one of the benefits moving forward. I would say a second thing is just the community partnerships. We've worked really closely with St. Joe's Hospital, who we're obviously associated with, but just worked with the health department and also with Michigan Medicine to decide on what needs to happen as a community. And then I think the last thing is really having to think about new ways to deliver care in really innovative ways. And I think we've done a good job of doing that. But it has challenged us to quickly think on our feet and think about how to keep everyone safe.
Well, and Dr. Walsh, thank you for that. That's a good reminder as we go into the discussion here, that we presume so often that when we deal with doctors in particular, you have such specialized knowledge that there's sort of an assumption on the part of sort of lay people, if you will, that you know these things. And as we're dealing with an emergent disease, and a disease that we are all learning about, not only are you providing treatment, but at the same time you're learning as you go, let alone some of the challenges that you face just maintaining the infrastructure of your health providing organization. So it's a tall task. We appreciate the work you're doing there. And Dr. Salameh, if it's okay, maybe we could start with you. Just a quick look back. This has all happened in a relatively quick period of time, to go from hints at the start of the year to a shutdown by mid-March. And I guess the question is, how did your medical care group, how did you continue to care for patients when so many things were going on at that shutdown with so many unknowns? What was that process like? How'd that happen?
So I think the key was kind of recognizing the current situation and what patients now are at risk for, and how can we continue to provide care, but also do so in a safe way. I think we started with the idea that we wanted to limit the risk to any patients who are coming to seek care who were not coming to seek care for COVID-like symptoms. So as Marty mentioned, we had the urgent care set up that we're only seeing patients with symptoms that were consistent with COVID, and took extra precautions at those sites to utilize innovative ways of caring for patients. We utilized car waiting rooms. We limited the number of patients that could be in any one room at any given time. We were doing a lot of screening. We're using masks and other personal protective equipment to limit risk, not only to our patients, but also to our staff. If our staff are getting sick, we can't provide that care. While that was happening, we also then really aggressively sought after abilities to provide care using these new platforms. We have some software tools that we utilize that can provide telephone visits. We stood up Zoom platforms to provide video visits. We have a call center that was open, that continues to be open 24/7, 365 days a year. So if patients had questions, to call in. they can still access a provider on call 24/7. As you know, IHA is a multi-specialty group. We have over 35 medical specialties. We found ways to connect our specialists with one another to provide consultation for common patients. I think in a very short period of time, went from about 70 open sites we were providing care to less than 30. Consolidated staff and providers in such ways that we were still able to provide brick and mortar services as well. But we were very deliberate on calling patients the day before, make sure they did not have any symptoms before they entered one of those facilities. So in short order, I'd say probably span of about 5 days, we went from fully functioning at 70 locations to a consolidation and being very aggressive in providing video visits. So it was really just a concerted effort by everyone within the organization to use the technology available to us to continue to provide access to our providers. And we were making tough decisions with the patients involved in that decision making to defer some care that we thought we could do defer safely to future visits. But we also made sure that those patients who did require urgent care or more time-sensitive care still were able to access us, and we continue to do that. And I think a key part of this has been our ability to also partner with our hospital partners at St. Joe's in Ann Arbor, Livingston, and other communities, staying in tight communication with them in terms of what they were doing as far as changes and making sure our approach was linked to theirs.
Thank you. I can't imagine how that went with that many balls in the air, but thank you for that description. And Dr. Walsh, for you, one of the questions that came in while Dr. Salameh was speaking, which I think a lot of folks have, is what do we need to know as we re-enter the workforce in terms of the testing process, and also, to be quite candid, how can we know and feel secure in accessing healthcare services, either at our doctor's office or in some other way that involves one-to-one interaction? What assurance could you offer, at least a description of the process?
Yeah, so I think that's a great question. We get asked the question a lot: how do we keep people safe? And I think number one is wearing a mask, and wearing a mask helps to protect you, but really helps to protect those around you as well, if you've been infected from getting COVID. And I would say that one thing that we feel really comfortable around is that we've had enough personal protective equipment at IHA. So our staff has been wearing masks for a long time. We now give masks to patients as well. And then hand washing is really important. So you can wash your hands for 20 seconds. That's as effective as using a hand sanitizer. And then really, cleaning surfaces regularly, like I mentioned that we were doing. From the perspective of keeping patients safe, one of the things that we're using is one of the tools that's now at hand for us is telehealth. So, a lot of times we're doing a telehealth visit before the patient ever comes into a practice to see if they really do need to come into a practice. Obviously, there's certain things that need to be seen in person. And if that's the case, then we do set up the appointment for a patient. But a lot of times we're doing that screening via telehealth, and we're learning so much about what can efficiently be seen by telehealth that never needs to come into a practice. There's a lot of things that lend themselves to telehealth visits, and then the patients never need to ultimately be seen. Our urgent cares are also doing some telehealth visits too, just assessing whether or not a patient needs to be seen, or caring for the patient via a telehealth visit. I think one of the things that's most important too is in keeping our patients safe is that we're screening all patients before they come in. We're screening them at the time, so a phone call before they come in. We're screening them at the time of their visit and deferring them to another location. We're limiting visitors to really only people that need to have someone with them to help them into the visit. So it's such as a parent of a child, or in patients that are older that need someone to help them get into the actual visit. So really limiting that as well. You had asked a little bit about testing. So I think it's important to distinguish between screening, and screening really just means we're screening you for symptoms. versus testing, which is we're actually doing the test on you. And so the test for COVID, as many of you might know, is a nasopharyngeal swab. So it's a swab that goes into the very back of your nasal passage. And that's what we call a PCR swab. So it actually looks for the COVID DNA that's there. And that's quite an accurate test, but that's how we're testing right now for patients that are infected. There have been a lot of questions about antibody testing, and antibody testing, there's been a lot of inferior tests that have been released for antibody testing. So antibodies are what your body develops after you've had a disease and gives you some immunity to a disease. Because COVID is brand new, we don't necessarily know if patients that have antibodies will be immune to the disease because it's so new. We think that at St. Joe's we'll be able to offer that test sometime in the next week or two, but there still are a lot of questions about, and it's a sensitive and accurate test that we'll be offering, but there's still a lot of questions about the use case for antibody testing and who should actually have antibody testing. So, that there's still a lot of question regarding that. And, I'm happy to communicate more when we know more about what we think is the best use case for that. But antibody testing is not, I want to be clear, is not to be used to diagnose the disease. It's really to be used to diagnose that you have antibodies after you've had the disease. So if someone has had the disease, we would make an assumption that they have antibodies after that. But we don't know what the immunity is that having antibodies infers.
So the three components are, one, knowing the difference between screening and testing. Screening being sort of a general check of, do you have symptoms that would possibly indicate COVID. The testing itself, which, if we're hearing you correctly, is absolutely an accurate test, perhaps a touch more invasive than we're used to in just day-to-day life. And then coming data and testing on antibodies as a more macro information gatherer. Is that roughly correct?
I think that's correct, Andy. I would say, the PCR test that I was talking about, the nasopharyngeal swabs, there are some false negatives. So I would say to people, if you're tested and you have a negative test, that if you have symptoms or worsening symptoms, then we would recommend that you get retested. And again, I can't emphasize enough, this is a new disease. And so, normally what we'd look at is we'd be able to tell you what is exactly the sensitivity of the tests that we're doing. But that depends on knowing that someone was positive or knowing that someone was negative. And we don't, we're still kind of gathering a lot of that data right now. So I would just put it out there. If you have a negative test but have worsening symptoms, we'd always recommend being retested.
Well, thank you. And I had an urgent question come in while you were giving that answer, Dr. Walsh, and Dr. Salameh, please jump in too. Raw hands. Everybody's trying their best to do the best hand washing they can. But do you have any advice in terms of hand cream or lotion to keep those hands from perhaps being more painful than they need to be?
It's interesting you asked that question. One of the things that IHA actually published for all of Trinity, we worked with our dermatologist, wound care specialist, and ID specialist to develop guidance for healthcare workers who were developing rashes around their face from the N95 masks. So it was a real issue. Folks not wearing those N95 masks all the time to now suddenly wearing them often applied pressure and caused some skin breakdown. And it really, we don't say that there's a particular brand that is necessarily better than another brand. Our wound care specialist and dermatologist said anything that has a high amount of aloe in it would be the most effective. So simple lotion that has aloe hand moisturizer, I think makes a lot of sense. And then when you're using your hands, I like to wash dishes and other things like that, wearing gloves, it may be worthwhile if you can get your hand on some gloves.
Keep the wear and tear down a little bit. But
right, because that does become an issue if your hands are super raw, if you have diabetes or whatnot, and you get a skin breakdown, could lead to infections. So providing that maintenance of care is really important. Great.
And for both of you, doctors, what are some of the new services that are starting out to be offered and that we should be on the lookout for? Frankly, just so we know what options are there now that weren't, pre-COVID?
Yeah, I think it's interesting, Andy, that some of these things are things that we've wanted to do for a long time, but have been opened up a little bit because of COVID, and now many of the health plans are willing to talk through some of these things with us. So one of the things that we've been looking at is doing home visits for our patients that are at highest risk for having COVID or having complications of COVID. And so we're starting to pilot a home visit program where physicians are actually going to patients' homes and seeing the patient in the home just to keep them as safe as possible. There's a program where we can establish hospital level care in a patient's home. It's called Hospital at Home. That's been a well-documented program and has been very beneficial, but hasn't been covered by Medicare or many of the other health plans. But in this environment, we're exploring this more because we want to keep as many patients out of the hospital and home if they can get appropriate care in those sites. So we're exploring a lot of new clinical innovations that we wanted to explore before, but really had limited capability to do. So it's in some ways, I'm trying to always look at the positives of the situation that we're currently in, just thinking through that some of these care innovations and being able to leverage some things that we were interested in doing before has been one of the benefits.
Sure. Necessity being the mother of invention. Oh, that's a good thing to keep in mind. And Dr. Salameh, beyond any other services that are offering, we are all in a heightened state of awareness around issues related to health. What should we take away from today? If we remember nothing else, are there a few points that we should be aware of and keep in mind just generally? Dr. Salameh, while I am very interested to hear you, you are on mute. I'm sorry, there we are.
As I was saying, I think the overarching theme and takeaway here is that we're still open for business to serve patients. COVID-19 really did create a significant amount of need to be innovative, to deliver care. Even through that, we've been open for business, and we continue to be as the economy starts opening up again. We encourage patients to seek care for time-sensitive conditions, or if there's any chronic illnesses that they may have, even healthcare screening. There's literature out there that says folks who have delayed screening have had cancers and other things missed that could have been caught earlier during this situation. So I think reinforcing to our patients and to the community that we are here to serve you in a partnered way with St. Joe's, and doing so in a safe way. Make sure folks understand that we're taking every effort to keep our staff and our patients safe while still offering care. And that care doesn't necessarily always have to be in a brick and mortar face-to-face encounter. It could be at the home, as Marty stated. It could be via video, via screening before you ask a patient to come in. But I think overall, I would just say that we are here, and we're here to serve the community. And as we learn more, I think it's going to be key for us to communicate and continue to partner with organizations like the Chamber, who are all here to serve one another and serve the community.
And Dr. Walsh, anything you would want us to take away? And we appreciate this so much, but any knowledge we should walk away with?
So two things. I think one thing that's very important is that many patients have been deferring vaccinations during this time, and we still feel like that's a very important thing to have done. I was on a call with the state recently where they were talking about that they were concerned about potential other outbreaks that might occur because patients aren't getting vaccinations, something like measles or something like that. So all of our pediatric practices are still available and open for vaccinations for children. So just wanted to emphasize that that's really important. And then the second thing I think is that even though we have, decreased brick and mortar seeing patients right now, just because we've kind of put that off for a period of time, although we're still seeing patients in brick and mortar, I want to just emphasize that it's still important to get health care. And so the safest thing we could do over the past month or two was to keep our patients home. But that doesn't mean that we don't still need to see you regularly for chronic conditions, and that we want to see you regularly for those types of things. And so we're always assessing how do people keep our patients most safe. And during this period of time, that was the safest thing to do. But now we need to see all those patients again for those chronic conditions. We just don't want people to put off care.
So the world has changed, and your service offerings are changing and evolving to meet those needs, but we still have to do the normal work of maintaining our healthcare, both the services we need and the communication we have with our healthcare providers. We can look to IHA website or our individual providers for useful information on when to come in, when to get service via telemedicine or so forth, and what is a right now issue and what is a soon issue, those sorts of things. Anything else to walk away with?
I think accessing our website and also reaching out to our providers both are excellent options. Amy Middleton does a fantastic job with her team of updating the website almost on a daily basis as this evolves. So continue to look to us as a resource in that area. And then obviously anytime established patient or new patient has a question, they can call one of our offices, and I think we're working very closely with one another to make sure those questions are answered as they're coming in.
Well, Dr. Salameh, Dr. Walsh, on behalf of the Chamber, thank you so much for being available with us today, and thank you to IHA more broadly for all the great work they are doing in this difficult time. We appreciate you being a community member here. We appreciate your involvement with the Chamber. And most importantly, we appreciate the services you provide that keep our people safe and healthy, and especially at a time like this. So thank you so much for being with us today.
And thanks for the opportunity to speak with you as well.
Thank you.
Thank you. And thank you to all our members for being with us, and look for us again at the next event. You can always check a2ychamber.org for an updated listing. Thank you and have a wonderful day.
You too.